Namaste. The goal of this video is to help you answer MCQs and write university exam answers on septal abscess. Look at this diagram. These are the turbinates. This is the septal cartilage. This is the perichondrium. In septal abscess, there is pus in between the septal cartilage and the perichondrium. So septal abscess is defined as collection of pus between the septal cartilage of the nose and its perichondrium or the periosteum. Once we have understood the definition of septal abscess, we can move forward and look at the etiology. Most commonly, it occurs secondarily to a hematoma. Trauma to the nose leads to hematoma, and hematoma can get infected to form an abscess. It can occur after furuncle of nose or upper lip. It can occur following acute infections such as typhoid and measles. The most common organism causing septal abscess is S. aureus. Other cause is streptococcus and rarely anaerobes. Let's understand the pathophysiology. Starting with the most common cause, that is septal hematoma. It will get a bacterial infection due to which pus will collect between the septal cartilage and perichondrium. What does this do? It separates cartilage from the blood supply. We need to understand a point here that septal cartilage gets nutrition from perichondrium, and here this is disrupted. Due to this, cartilage necrosis occurs. Due to necrosis, saddle nose deformity may occur. And saddle nose deformity is the most common complication of septal abscess. This is an important point. That's the pathophysiology. Let's look at the clinical features now. Most of you can guess the presenting symptom right, that is severe bilateral nasal obstruction, because the abscess was obstructing the nasal cavity. And there will be associated pain and tenderness over the nasal bridge. Due to pressure on the nasal bridge, frontal headache will occur. Other symptoms are fever with chills and skin over the nose will be red and swollen. On internal examination, when we look at this abscess, we will see a smooth bilateral swelling of the nasal septum. Fluctuation can be elicited and the septal mucosa will be congested. There may or may not be submandibular lymph node enlargement and tenderness. We have just read that the patient with septal abscess is presenting with bilateral nasal obstruction. So what will be the first treatment which we are going to do? We have to relieve the obstruction, right? So we are going to drain it ASAP. Then we give an incision in the most dependent part. After the incision, a piece of mucosa is excised and pus and the necrosed cartilage is removed by suction. The incision may or may not be reopened daily for 2 to 3 days to drain pus and remove necrosed pieces. Systemic antibiotics are to be taken for at least 10 days. According to the pathophysiology, the blood supply of the cartilage is disrupted and it gets necrosed. So necrosis is a complication. Then depression of the dorsum follows. Depression of dorsum may require augmentation rhinoplasty. Then septal perforation can occur. Meningitis and cavernous sinus thrombosis. These are the complications of septal abscess. Once you remember the definition, the diagram and pathophysiology of septal abscess, you will automatically be able to write the clinical features, the treatment and complications. So focus on the basics. Thank you, and you will find the notes in the comment section.